This demonstration will be a tutorial for preparing provisional crown, prefabricated polycarbonate crown on tooth number 11. We use this type of material because of its extremely high impact strength and it is easier to be fabricated. Putty index and its activator. We will be using it in this video as a guidance for a proper amount of reduction on the tooth, and another use for it is to fabricate temporary custom-made crown. Petroleum jelly, or the popular brand name Vaseline. Low-speed handpiece tools, and they are carbide acrylic burr, polishing rubber cup, polishing powder pumice. Temporary acrylic resin or polymethyl methacrylate, spatula, silicone dipping dish. Articulating paper, shim stock and tweezer. Firstly, we will take amount of putty index and on a circular motion we should shape it as a spherical shape. Then we add a line of the activator on the surface of the putty. After that we start mixing them together till we reach a homogeneous color to get appropriate setting time and texture. Secondly, we place the putty index on the tooth we are attempting to prepare and extend it to its adjacent from both sides, in addition to few teeth that are located distally to the tooth we intended for restoration, as well as to capture few millimeters of the soft tissue, along with making the putty index thick enough to allow for rigidity. Next, after making sure that the material is set, we remove the putty index from the patient's mouth. In this step, we will be cutting the putty index with the blade instrument in the middle half of the tooth we are attempting to prepare. Always record a shim stock hold before tooth is prepared by placing it on the occlusal surface of both adjacent teeth and letting the patient bites on it while pulling it with the tweezer. Moreover, we start preparing the tooth with the high handpiece, choosing the large round-ended tapered diamond burr, with 2 mm reduction on the incisal surface and 1.2 to 1.4 mm on the axial walls, along with equigingival finish line. Furthermore, we coat the prepared tooth with the petroleum jelly on all surfaces of the tooth, in addition to its two adjacent, to prevent the lining material from sticking to the tooth structure, together with the soft tissue that surrounds the tooth to prevent the resin material from irritating the skin due to free monomer. Admittedly, choosing the size of the crown from the mold guide provided in the kit, according to its mesial distal width, not the occlusogingival length nor the buccolingual dimension. After selecting the crown, we place it on the prepared tooth to determine the amount of trimming and make sure the crown is not crossing the finish line to preserve the marginal integrity. As a general rule, the excess length is trimmed away with carbide acrylic burr from the gingival line until we found the incisal edge of the polycarbonate crown is the same as its adjacent, with hand positioned in modified palm and thumb grasp with angulation to prevent cutting the inner and interproximal surfaces, although the interproximal area can also be adjusted if it's too tight. Now we do the mix of the powder and liquid according to the manufacturer instructions, and here is 1 quart powder and 3 quarts liquid. We place them in a silicone dipping dish and mix them with the spatula. The consistency should be creamy, and the material have working time of 2 to 3 minutes. Next step is filling the polycarbonate crown with the lining material. Then, we place the polycarbonate crown over the prepared tooth and stabilize it until it reaches the rubbery stage. The lining material has an exothermic period that lasts 4 to 7 minutes, so it's important to remove and place the crown in vertical motion during this period to prevent thermal injury to the pulp. In the same time, avoid moving the crown in different dimensions or it will lead to widening and enlargement of the inner surface of the crown, which will cause displacement of it. Again, we will be using the carbide acrylic burr to remove the excess of the lining material over the finish line. After finishing the step of removing the excess, we should trim the handle of the crown as well as any irregularities. Now we need to check for the occlusion and the centric relation by using the articulating paper and the shim stock. When using the articulating paper, we should remove the high points of the crown that are marked on it, and again apply the articulating paper until we found the marking on the prepared tooth and its adjacent, which is 2-1, are the same. Now we need to ensure that the occlusion is restored by reapplying the shim stock when provisional crown has been fitted. As a final checking, the explorer needs to run thoroughly between the prepared tooth structure and the provisional crown smoothly with no catches. Lastly, polishing the polycarbonate crown by using the polishing rubber cup and the polishing pumice for achieving shiny and luster appearance.